Hello, everyone. Bonjour à tous. Welcome, and thank you for participating in today's press conference, which will provide an update on the COVID-19 situation, as well as an update on the vaccine rollout in Canada. Today's press conference will also include the National Advisory Committee on Immunization's updates to its statement on recommendations on the use of COVID-19 vaccines. Bienvenue à la conférence de presse d'aujourd'hui qui donnera une mise à jour sur la situation de la COVID-19 au pays et aussi une mise à jour sur la distribution des vaccins contre la COVID-19 au Canada. La conférence d'aujourd'hui inclura aussi les mises à jour de la déclaration du Comité consultatif national de l'immunisation sur ses recommandations au sujet de l'utilisation des vaccins contre la COVID-19. Today, we will hear remarks from Dr. Theresa Tam, Dr. Howard New, and Brigadier General Krista Brody from the Public Health Agency of Canada. They will be accompanied by Dr. Matthew Tunnis, Executive Secretary of the National Advisory Committee on Immunization Secretariat, and by Joël Paquette from Public Services and Procurement Canada to answer questions. Aujourd'hui, nous entendrons des allocutions du Dr. Theresa Tam, du Dr. Howard New et de Brigadier Général Krista Brody de l'Agence de la santé publique du Canada. Ils seront accompagnés par le Dr. Matthew Tunnis, secrétaire exécutif du secrétariat du Comité consultatif national de l'immunisation, et de Joël Paquette de Services publics et Approvisionnement Canada pour la période de questions. Following the remarks, we will open the teleconference line for questions from the media. Suite à la présentation, nous répondrons à vos questions. If you wish to ask a question, please press *1 on your phone. Si vous désirez poser une question, veuillez appuyer sur *1. Alors procédons. Let's begin. Over to you, Dr. Tam.
Thank you very much, and bonjour à toutes et à tous. Thank you for joining us today for an update on Canada's COVID-19 vaccine rollout. My colleagues have been introduced by the moderator, so I thank them for being here today. This week, once again, we're seeing impressive numbers in vaccine coverage. More than 30 million doses have been administered to date. And as of June the 12th, 73% of the population in Canada aged 12 and older has rolled up their sleeves. As of June 11th, 2021, there have been 7,408 reports of adverse events following immunization. These include any medical events that occurs following immunization, but isn't necessarily related to the vaccine. 1,565 of these reports, about 1 in 18,000 doses administered, were considered serious, such as severe allergic reaction and vaccine-induced immune thrombotic thrombocytopenia, or VIT. Earlier today, the National Advisory Committee on Immunization, or NACI, released updated recommendations on first and second doses of COVID-19 vaccines authorized for use in Canada. NACI reviews new scientific evidence on COVID-19 vaccines on an ongoing basis and revises its guidance on the use of authorized vaccines accordingly. In making its recommendations, NACI considered the increased availability of messenger RNA vaccines in Canada, the emerging evidence suggesting better immune responses when a first dose of the AstraZeneca vaccine is followed by a second dose of the Pfizer, BioNTech, or Moderna mRNA vaccines. The risk of vaccine-induced immune thrombotic thrombocytopenia of it associated with the viral vector vaccines, but not associated with the mRNA vaccines, and principles of ethics, equity, feasibility, and acceptability. Based on the most recent evidence, NACI recommends that an mRNA vaccine, such as Pfizer-BioNTech or Moderna, should be offered to start a vaccine series unless there is a contraindication, for example, an allergy to one of the mRNA vaccine ingredients, or if an mRNA vaccine is not available. NACI's earlier recommendation that people who wanted earlier vaccinations could receive a viral vector vaccine rather than wait for an mRNA vaccine reflected the limited supply of mRNA vaccines at the time and the imperative of protecting vulnerable populations from serious illness and death during a time of resurgence of COVID-19. That recommendation has now evolved. For second doses, NACI recommends that individuals who received a first dose of an mRNA vaccine, such as Pfizer-BioNTech or Moderna, should be offered the same mRNA product for their second dose. If the same product is not readily available, or the product used for the first dose is unknown, another mRNA vaccine is considered interchangeable and should be offered to complete the series. In addition, an mRNA vaccine should now be offered as the second dose for individuals who received a first dose of AstraZeneca or COVISHIELD vaccine. This change is based on emerging evidence indicating a potentially better immune response from this mixed vaccine schedule and to mitigate the potential risk of VIT associated with viral vector vaccines. I wish to emphasize that people who receive 2 doses of AstraZeneca COVISHIELD vaccine can rest assured that the vaccine they receive provides good protection against infection and very good protection against severe disease and hospitalization. We are aware of and are closely monitoring reports of rare cases of myocarditis and pericarditis, heart inflammation, following vaccination with mRNA vaccines. NACI is closely following these reports, as are scientific experts at the Public Health Agency of Canada, Health Canada, and the provinces and territories. There is no clear association yet established between vaccination with an mRNA vaccine and this condition. As with all adverse events that are reported following vaccination, we work with our international research and public health colleagues to investigate thoroughly and take appropriate action if needed. I want to remind everyone that despite Canada's tremendous progress in getting people vaccinated, we are not out of the woods. We all need to complete a full vaccine series to give our immune systems the best possible shot at fighting off infection from COVID-19. So get that second dose as soon as it's offered to you. Thank you.
Bonjour tout le monde. Merci de vous joindre à nous aujourd'hui pour la mise à jour sur le déploiement des vaccins contre la COVID-19 au Canada. Je suis accompagné de la Dr. Theresa Tam, administratrice en chef de la santé publique du Canada, et de Madame le brigadier général Krista Brody, vice-présidente des opérations de la logistique à l'Agence de la santé publique du Canada. Pour nous aider à répondre à vos questions, nous sommes accompagnés de Dr. Matthew Tunis du secrétariat du Comité consultatif national d'immunisation et Joël Paquette du service public et approvisionnement Canada. Cette semaine, nous observons une fois de plus des chiffres impressionnants en ce qui a trait à la couverture vaccinale. Plus de 30 millions de doses ont été administrées à ce jour et en date du 12 juin, 73% de la population du Canada âgée de 12 ans et plus avait retroussé ses manches. En date de 11 juin 2021, nous avons reçu 7,408 signalements d'effets secondaires suite à la vaccination. Cela comprend tout phénomène médical qui se produit après la vaccination, mais qui n'est pas nécessairement associé au vaccin. 1565 de ces signalements, soit environ un quart sur 18 000 doses administrées, concernent des effets secondaires considérés comme graves, notamment une réaction allergique grave,
allergic reaction and vaccine-induced immune thrombotic thrombocytopenia, or VIT. Earlier today, the National Advisory Committee on Immunization, NACI, released updated recommendations on first and second doses of COVID-19 vaccines authorized for use in Canada. NACI reviews new scientific evidence of COVID-19 vaccines on an ongoing basis and revises its guidance on the use of authorized vaccines accordingly. In making its recommendations, NACI considered the increasing availability of mRNA vaccines in Canada, emerging evidence suggesting better immune responses when a first dose of the AstraZeneca vaccine is followed by a second dose of the Pfizer-BioNTech or Moderna mRNA vaccines. The risk of vaccine-induced immune thrombotic thrombocytopenia associated with viral vector vaccines is not associated with mRNA vaccines, and the principles of ethics, equity, feasibility, and acceptability. Based on the most recent evidence, NACI recommends that an mRNA vaccine, such as Pfizer, BioNTech, or Moderna, should be offered to start a vaccine series unless there is a contraindication, for example, an allergy to one of the mRNA vaccine ingredients, or if an mRNA vaccine is not available. NACI's earlier recommendation that people who wanted earlier vaccination could receive a viral vector vaccine rather than wait for an mRNA vaccine reflected the limited supply of mRNA vaccines at the time and the imperative of protecting vulnerable populations from serious illness and death during a time of resurgence of COVID-19. That recommendation has now evolved. For a second dose, NACI recommends that individuals who received a first dose of an mRNA vaccine, such as Pfizer, BioNTech, or Moderna, should be offered the same mRNA product for their second dose. If the same product is not readily available, or the product is used for the first dose is unknown, another mRNA vaccine is considered interchangeable and should be offered to complete the series. In addition, an mRNA vaccine should now be offered as the second dose for individuals who received a first dose of the AstraZeneca COVISHIELD vaccine. This change is based on emerging evidence indicating a potentially better immune response from this mixed vaccine schedule and to mitigate the potential risk of VIT associated with viral vector vaccines. I wish to emphasize that people who receive 2 doses of AstraZeneca COVISHIELD vaccine can rest assured that the vaccine they received provides good protection against infection and very good protection against severe disease and hospitalization. We are aware of and are closely monitoring reports of rare cases of myocarditis and pericarditis, heart inflammation, following vaccination with mRNA vaccines. NACI is closely following these reports, as are scientific experts at the Public Health Agency of Canada, Health Canada, and the provinces and territories. There is no clear association yet established between vaccination with an mRNA vaccine and this condition. As with all adverse events that are reported following vaccination, we work with our international research and public health colleagues to investigate thoroughly and take appropriate action if needed. I want to remind everyone that despite Canada's tremendous progress in getting people vaccinated, we are not out of the woods. We all need to complete a full vaccination series to give our immune systems the best possible shot at fighting off infection from COVID-19. So get that second dose as soon as it is offered to you. Thank you. And now I would invite Brigadier General Krista Brody to speak.
To date, we have delivered more than 35 million doses of COVID-19 vaccines across Canada. This week's distribution of 2.4 million doses of Pfizer-BioNTech, our weekly shipment throughout the month of June, is complete. Yesterday, Pfizer-BioNTech informed us of an adjustment in its upcoming July shipments. They have committed to deliver the full number of doses expected for the month of July. However, we now expect lower allocations in early July and larger allocations later in July to offset. Projections for Moderna have increased since last Friday's announcement. Instead of 2 shipments from our Moderna supply arrangement, we are now receiving 3 shipments for a total of 8.5 million Moderna doses, a net increase of 1.5 million doses over what we announced last week. The first of those shipments arrived yesterday. The other 2 shipments are set to arrive in Canada on June 18th and 22nd. Allocation tables have been updated, and we are processing orders for the provinces in real time to distribute these doses as quickly as possible. We are also receiving a 4th shipment of 1 million doses of Moderna this week, as announced this morning by way of the U.S. dose sharing agreement. These doses will be available for distribution to the provinces next week. These are significant changes from what I announced at last week's technical briefing, and there will be more changes to come as we work with manufacturers to confirm upcoming delivery schedules. Over the next 2 weeks, we are bringing in and distributing more than 14 million doses of the COVID-19 vaccines. This is the big lift. Vaccine supply is rapidly increasing. This allowed us to complete regular shipments to the territories last week and is allowing provincial jurisdictions to accelerate their programs. This week represents the single highest volume in terms of shipments and deliveries completed since we started distributing COVID-19 vaccines in December 2020. In a single week, we are bringing in more doses than we did in all of Q1. We are monitoring closely to ensure we match vaccine supply to anticipated demand as we track closer and closer in the coming weeks to having the appropriate number of doses available to fully immunize eligible Canadians. We are working tirelessly to ensure that we can vaccinate and protect as many people as possible, as quickly as possible. À ce jour, nous avons livré plus de 35 millions de doses de vaccins contre la COVID-19 au Canada.
More than 35 million doses of COVID-19 vaccines across Canada. This week's distribution of 2.4 million doses of Pfizer-BioNTech, our weekly shipment throughout the month of June, is complete. Yesterday, Pfizer-BioNTech informed us of an adjustment in its upcoming July shipments. They have committed to deliver the full number of doses expected for the month of July. However, we now expect lower allocation in early July and larger allocation later in July to offset. Projections for Moderna have increased since last Friday's announcement. Instead of 2 shipments from our Moderna supply arrangement, we are now receiving 3 shipments for a total of 8.5 million Moderna doses, a net increase of 1.5 million doses over what we announced last week. The first of those shipments arrived yesterday. The other 2 shipments are set to arrive in Canada on June 18 and 22nd. Allocation tables have been updated and we are processing orders for the provinces in real time to distribute those doses as quickly as possible. We are also receiving a 4th shipment of 1 million doses of Moderna this week, as announced this morning by way of the U.S. dose sharing agreement. These doses will be available for distribution to the provinces next week. These are significant changes from what I announced at the last week's technical briefing. And there will be more changes to come as we work with manufacturers to confirm upcoming delivery schedules. Over the next 2 weeks, we are bringing and distributing more than 14 million doses of COVID-19 vaccines in Canada. This is the big lift. Vaccine supply is rapidly increasing. This allowed us to complete regular shipments to the territories last week and is allowing provincial jurisdictions to accelerate their programs. This week represents the single highest volume in terms of shipments and deliveries completed since we started distributing COVID-19 vaccine in December 2020. In a single week, we are bringing in more doses than we did in all of Q1. We are monitoring closely to ensure we match vaccine supply to anticipated demand as we track closer and closer in the coming weeks to having the appropriate number of doses available to fully immunize eligible Canadians. We are working tirelessly to ensure that we can vaccinate and protect as many people as possible, as quickly as possible. Thank you.
We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking your questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question suivie. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. We will start with the first question. Première question, opérateur.
Thank you. Merci. Mia Robson with the Canadian Press. Please go ahead. À vous la parole.
Hi, my first question is for Dr. Tam. Just wondering if you could explain a little bit more what evidence NACI's new recommendations are based on. Did we see additional evidence and what's on studies that were showing a better immune response from getting a different second dose? And also if you could provide any updated details or data we have on VIT, particularly after a second dose in Canada, how many cases we have seen so far from after first and second doses.
Thank you for the question. So recalling that the last update that I did on behalf of NACI in terms of their recommendations was not that long ago. So what's happened in that interval that's resulted in an update to these recommendations? Well, there's just increasing numbers of studies, mostly from Germany, that we've accumulated in between that last set of recommendations and today's recommendations. And all of them essentially points towards the fact that it is safe to provide a mixed dose schedule that is after a first dose of AstraZeneca or COVISHIELD vaccine to be followed by a mRNA vaccine. But it's really the immunogenicity, that immune response after that mixed dose schedule that's resulted in NACI updating this recommendation because all of the accumulated study essentially suggests that that immune response is a better response. And of course, we will continue to monitor this in sort of the real life basis as vaccines are rolling out. But that's really not that there was at least 3 studies from Germany. And today we're just catching up to the 4th study from Germany, which essentially shows the same thing, that immune response, that antibody response, but also the cellular response, those T cells and other part of the cellular immune system performed very well and seems to have a superior response with that mixed schedule.
It's Dr. New. I can maybe add to the question about VIT and the number of cases reported to date. As of June 13th, we've received a total of 56 sort of reports overall of blood clots associated with low platelets. And of those, 38 were also positive for the so-called anti-PF4, which meets the VIT definition. Certainly from the data we have to date, the majority are after only the 1 dose. So we don't really have sort of information with respect to second doses. They are sort of dose unspecified for a number of cases. So The majority of cases are really after the first dose, but we can certainly track back and see if there are any additional reports coming from the provinces and territories with respect to any quote vid cases after a second dose. But at the present time, it's all related to first doses. Thank you.
Thank you. And I'm also wondering, Dr. Tam or Dr. New, is there any suggestion yet that somebody who has had a transplant needs an additional dose of vaccine? I know there's been some discussion and study about whether 2 doses is not enough for that population. Just wondering if if there's any consideration for whether transplant recipients should get a 3rd shot sooner than sort of potentially boosters down the road.
Thank you for the question. That is an area of active investigation internationally. So NACI is following those studies very carefully. Of course, it would not be surprising to think that those who may have a suppressed immune system may generate a different or immune response after vaccination. So that is a really good question. At the moment, there is no specific update to the NACI recommendations, but this is an area of active analysis. And so we will, of course, update everyone should NACI make a recommendation in this space. But of course, just to add, there are many individuals in our communities who may not be able to get the vaccine because of underlying medical conditions, or who may not generate a great immune response even after 2 doses. This is why we need to all roll out our sleeves and get 2 doses of vaccine, not just for personal protection, but really to protect those around us who may not be well protected. Thank you.
Thank you, Dr. Tam. Next question. Prochaine question.
Thank you. Merci. Raymond Fillon avec TVA. Please go ahead. À vous la parole.
Merci. Question pour Dr. New.
Thank you. I have a question for Dr. New. How big is the growth of the variants in the country? We've talked about it in Ontario, but can you tell me about figures for the Delta variant? Thank you very much for the question. I know that everywhere in the country there has been alerts of the variant called Delta. In Ontario, it is something that
la souche, vraiment, comment dire, le plus important parce que je pense qu'en Ontario, c'est presque 50% des nouveaux cas sont de la variante Delta. Donc, c'est vraiment un enjeu important. On sait que le variant Delta est plus transmissible aussi, c'est aussi peut-être plus grave pour les conséquences. Donc, c'est quelque chose à suivre et on sait que toutes les provinces et territoires prennent l'enjeu pour sérieux et c'est important de continuer avec notre surveillance. Mais pour souligner le point aussi de Dr. Tam, et on a répété ça plusieurs fois que c'est très important de se faire vacciner avec les 2 doses pour compléter la série parce que avec les études, par exemple, qu'est-ce qui se passe en Angleterre, on a trouvé qu'après une dose de vaccin,
after 1 dose of the vaccine, you do have a certain level of protection for Delta, perhaps 30%, but it's a much higher level of protection with the second dose. So Canada has to continue to follow the health advisory at the local level and obtain 2 doses. Yes, I could add that there were 941 cases of Delta variant reported in Canada.
Of course, it may not be all the cases.
Très bien, merci, Dr. Tam.
Thank you very much, Dr.
Je reviens
Tam.
à Dr. New.
To Dr.
Dans
New,
l'optique où il y a des régions qui sont particulièrement touchées, dans la grande région de
when there
Toronto,
are
est-ce que les
regions
gens
that are
devraient
particularly
voyager
affected,
d'une
like
région
the
à l'autre à ce moment-ci,
GTA,
compte
should
tenu du
people
variant Delta?
travel from one region to another, given that fact?
Oui, ça c'est une bonne question. On sait
That is a good question. We still recommend not to travel outside of Canada for non-essential travel, but within Canada also this is an issue. But it is an issue for the provinces and the territories, and you have noted that there are hot spots in Ontario itself. And so it is always an issue that has to be dealt with at a local level. I think it's very important for all residents of a given region to follow the health advisories of their local authorities, to perhaps limit the number of contacts that they have. It's perhaps not a good idea to travel around everywhere in a region, but I really have to say that the advice is generated locally, and what is important is to encourage everybody to complete the series of 2 vaccinations.
Merci beaucoup. Prochaine question. Next question.
Thank you. Merci. Dan Ralph with the Canadian Press. Please go ahead. À vous la parole.
Thank you very much. Dr. New, if I may, if I could direct this question to you. The federal government's received the Canadian Football League's request for a national interest exemption for modified quarantine for the upcoming season, and I'm wondering where that might be, and as well as what the examination of the CFL's return to protocols might be, given that the league is looking at resuming play this year.
Okay, well, thank you very much for the question. I can remember getting this question last year, and I think we're in a sort of a different situation this year compared to last year, and much more, I think, encouraging. So I think in terms of the NIE, certainly with respect to players crossing the border and so on, I think the CFL has presented their protocols to us. We're obviously in the midst of examining them. But I would say that with the rate of vaccination throughout the country, I think the population as a whole is much more resilient, I would say, in terms of a good level of protection. I would say that the CFL has also given us good protocols in terms of, as you said, testing, maintaining the bubble. The other point I think that's very important is as well that we'll be following is the fact that CFL games are basically played in outdoor stadiums. So that's already a good starting point with respect to the sort of the summer. Everyone's at least being outdoors. With respect to things such as spectators, capacity and so on, those are things that are going to be examined closely, not just by ourselves, but obviously by the provincial authorities as well, depending obviously on the epidemiology in their jurisdictions, and also as the vaccination rollout proceeds. And as we've said repeatedly, the more Canadians are vaccinated, and also as the epidemiological situation improves throughout the country, then I think we can see more and more, as you say, a return to I wouldn't say completely normal life as before, but certainly a much better summer and a CFL season that we didn't have at all last year.
Yeah, and if I may follow up, they're talking about opening up training camp on the 10th of July and starting the season on the 5th of August. Given where you are with the review and examination of protocols, is that an equitable timeline? And what happens if if more time is required and we get into January 11th and 12th without approval of these protocols?
Sorry, I think I missed part of your question. You cut out a bit. I just understand that obviously time is of the essence. They have their proposed timeline in terms of training camps and the start of the season. I think certainly there are program staff within the agency are looking very carefully from a public health perspective. What the protocols are like. They're looking good. I can't give you a definitive sort of answer in terms of when they would be completing their review, and obviously there are other departments as well that are probably involved in making the final decision. But I would say at the present time things are trending in the right direction in terms of our review. But that's all I can say at this point.
Okay, so what I was asking, is there enough time to get it done by the 10th of July?
All I can say is we'll be making our best possible efforts, and I think everyone's working very hard to try and make this, as they say, win-win for everyone. But I can't really commit in terms of understanding some of the obviously various sort of a detailed, sort of analysis that the program staff here need to do.
Thank you, Dr. New. Next question. Prochaine question.
Thank you. Merci. Our next question, notre prochaine question is from Ashley Burke with CBC News. Please go ahead. À vous la parole.
Hi, thank you for taking my question. My first question is for Minister Anand. How many doses of AstraZeneca vaccine are still available in Canada, and what are you suggesting be done with that supply?
This is Joelle Paquette for PSPC. However, I will leave that question for General Brody, given that she is responsible for the distribution throughout Canada. Thank you.
So at last count, there is approximately 600,000 doses of AstraZeneca still in Canada distributed throughout the provinces, and those will be used in accordance with the provincial plans. And understanding the evolving NACI recommendations, we continue to expect that the use of those vaccines will continue to evolve over the coming days. Thank you.
And what kinds of conversations are you having with officials in the United States right now about Canadians who have received AstraZeneca shots being acknowledged as vaccinated, and how open are U.S. officials to this idea?
It's Theresa Tam here. Conversations with the United States at both the technical and of course at the more leadership level is ongoing. Those are some of the kinds of details that might be expected to be discussed. So, but I can't give you a specific answer at this point. But I would just like to point out that as Canadians, as people from Canada begin to travel anywhere in the world, you do have to look quite carefully at what the requirements might be of that country. At this point in time, when the world is only just beginning to open up and very few countries have been in a position where their population has been vaccinated, you're going to have to be a bit patient and do some research, because I think the world is evolving as we speak. And what is recommended 1 week might actually shift in real time. So that's the only advice I would be able to give at this point. Thank you.
Thank you. Prochaine question. Next question.
Thank you. Merci. Our next question, notre prochaine question is from Catherine Lévesque avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à tous. En fait,
Hello,
les questions
everyone.
sont soit pour Madame
I have
Paquette
a
ou la
question for
Brigadière
Madame
Générale
Paquette
Brody.
or
En fait,
for
je cherchais
Brigadier
peut-être à avoir
General
plus de clarté
Brody.
sur les
I'd
livraisons
like to
là, à
have
venir
more
en juillet de la
information
part de
about
Pfizer
the
dans
Pfizer
le programme
delivery
couverture.
in
Madame
July.
Brody, vous n'avez pas tout à fait dit qu'est-ce qu'on
Madame
allait
Brody,
avoir par
you didn't
semaine. Donc, je ne sais pas si vous
say
aviez
how
plus
much we
de
would get on a weekly
précision là-dessus, si
basis.
vous pouviez peut-être nous donner
So could you be more
une idée de
specific,
combien de
please,
doses on va
to give
recevoir à
us
chaque
a
semaine au
number
mois de
of
juillet. Merci.
an idea of the number of doses per week?
Donc, les allocations originaires
While the
étaient
regional
pour
allocations
2,3
were
millions de
for
doses par semaine en juillet.
2.3
Et
million
maintenant, on a une
in
allocation
July,
pour 900 000
and now
doses
we
pour
have
la première semaine de juillet,
900,000 for the first
semaine
week
de
in
5
July,
juillet,
that
et une
beginning on July
allocation pour
5,
1,4
and an
million de doses
allocation
pour la
for
deuxième
1.4
semaine de juillet,
million for
la
the second
semaine de 12 juillet.
week in
Et ça,
July,
c'est
beginning July 12.
les allocations qu'on a maintenant,
These are
avec
the
un
allocations numbers that
engagement
we
pour
have now, and
les
we have a commitment
pleines
for
compléments
the
de
full complement
9,1
of
millions de doses pour le
9.1
mois de juillet.
million
Merci.
doses for the month of July.
Très bien, donc j'en comprends que vous n'avez pas encore à ce moment-ci
Question, I
disons,
understand
les
that you
confirmations là,
haven't yet
des deux dernières semaines de juillet pour
received
Pfizer. Maintenant, sur
everything. You
Moderna,
have
je veux
the
juste m'assurer
confirmation for the
d'avoir
last 2
les
weeks
bons
for
chiffres. Donc,
Pfizer,
finalement,
but
ce que
I
vous
want to
nous
be
dites,
sure
dans le
that
fond,
I
c'est qu'on
have the
va
proper
avoir
figures.
donc
Can you tell me
8,5 millions de doses
8.5 million. Yes, 8.5 million doses of Moderna and the 9.5 million of Moderna over the course of 4 deliveries. Could you give me a little bit more detail about the figures that we received yesterday, that we are going to get a shipment on June 22nd? So how many millions are we to expect on each date? Answer. Between the 3 shippers that come under our regular agreements, we will have 8.5 million doses. Last week, I announced 7.1 with 2 deliveries, and now it is 8.5 with 3 deliveries. And in addition, we are going to get 1 million doses this week that come from the United States under the dose-sharing arrangement with the Americans. So for this week, 8.5 from Moderna plus 1 million, and that is the total for Moderna.
Merci beaucoup. Prochaine question. Next question.
Thank you. Merci. Once again, please press star 1 at this time if you have a question. De nouveau, veuillez appuyer sur étoile 1 si vous avez une question. Our next question, notre prochaine question, is from Annie Bergeron-Olivier avec CTV National News. Please go ahead. À vous la parole.
Hi, thank you for taking my question. I'm wondering what your message is to people who received 2 doses of AstraZeneca. Some people we've been talking to have received their second dose of AstraZeneca just minutes before your press conference. What is your message to those people who have continued to follow NACI's and Health Canada's advice regarding AstraZeneca, who now feel like they have been lied to, that they have been misled by your government, by NACI, by Health Canada, and are now confused, frustrated, and angry that once again, the rules are changing?
Yes, this is Theresa Tam. So NACI's advice has evolved over time according to the available evidence. So I believe that the committee has been extremely transparent and extremely careful and be timely with the advice. And it is difficult, of course, working and in this environment of change, and also to catch up with the recommendations. So I totally recognize that this is difficult for many. But what I would say is that those who've received 2 doses of AstraZeneca COVISHIELD vaccine, you've been provided with good protection against infection. But more importantly, AstraZeneca vaccine provides good protection against severe illness and hospitalizations. I'll just point out that even with the Delta variant, of course, 2 doses of AstraZeneca vaccine is important. It's that second dose. Whichever vaccine you get, that second dose is important. So you just made a really good choice of having had that second dose. But 2 doses of AstraZeneca actually provides really good protection against hospitalization in the UK study against that Delta variant. So I think people should feel very comfortable that they've received the vaccine that provides them with that kind of protection.
Thank you. And my follow-up is, you just said that somebody who got 2 doses of AstraZeneca made a very good decision, that they are well protected. So why change the advice? And going along with that, there are some people with AstraZeneca who are already facing some challenges. Look at Bruce Springsteen concert in New York saying that people who have AstraZeneca are not allowed to go because it's not approved by the FDA. So what confidence do you have that people who get any type of a mixed dose, whether it's AstraZeneca mixing or who mix with Pfizer, will be allowed to travel to places like the U.S. and will not face barriers because of decisions that Canada has made?
It's Theresa Tam again. So I would just want to emphasize that there is of course, the effectiveness from the 2-dose AstraZeneca or mixed dose. But one of the evolving evidence, of course, over time has been the observation of the rare but serious thrombosis event with low platelets. That, of course, played into the NACI advice. And that also is then balanced with the epidemiology of the time. And so it is a somewhat complex sort of way of looking at vaccine programs. But I think that Canadians have been extremely collaborative and patient with the evolving advice. So I do think that you've got your AstraZeneca vaccine. And these, rare side adverse events occur within a few weeks. And so, I think that you should feel fine after that period has passed. These are rare events, but we want to make sure people know that they occur. And then when they get the informed consent, that information is provided. So I believe the committee has been very transparent with that, and people shouldn't get a vaccine until they've understood or the important information that goes with that decision. The second question, I think, is a different question because every country has authorized different vaccines. So it's not just the United States. It could be different countries in Europe. It could be different countries in Asia. I mean, they're all making different policy decisions at the moment. So I think the important thing is engage in international discussions, whether they be the G7 or bilaterally the United States or others, to come to a point where we can accept each other's data, for example, and look at a path forwards that makes life, makes life easier, and that travelers are supported if they have been vaccinated. So I think that these discussions will continue. They will evolve. This is what happened to these individuals this week. That doesn't mean that the policy wouldn't evolve in the days to come. We are in the early days of resuming travel, and certainly in the early days of resuming travel, taking into account someone's vaccination status. But I think every one of us will do our best in looking at what can be achieved in the international discussions.
Thank you, Dr. Tam. That will be all for today's press conference. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Any additional questions can be directed to Media Relations at Public Health Agency of Canada. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à l'Agence de la santé publique du Canada. Merci beaucoup et bonne fin de journée.